One of the questions that comes up frequently is the difference between prescribing for a human being and prescribing for an animal. So I thought I would address that a bit, see if we can bring any clarity into it. It is a complicated question. Let me start with a couple of little stories. One is several years ago, an elderly family member was ill, actually died before too long. And the diagnosis was that there was cancer involving the uterus. And I was asked to look at the MRI report that had been sent to us. So I was reading the MRI report directly from the text, in which it said that the uterus was normal, that the uterine lining was normal, the uterine wall was normal, and so on. The reaction of those around me was that I was wrong, that I couldn't understand or know what that meant. The other story is, more recently, someone I met asked me about their dog some months ago that had some chronic problems that was recommended that there be surgery, and also that the kind of thing that involving the knee and cruciate and so on, that would have resulted perhaps in some improvement, perhaps not, as we well know. Certainly wouldn't have resolved it long term. So I recommended, we had some discussion, and I recommended some better nutrition and a homeopathic treatment, which I did not give, but rather recommended a veterinarian in their area that administered a remedy. And the dog did extremely well and recovered from its symptoms and became very lively and normal. So this particular woman, when I've met her again, and she introduces me, it's always full of praise, how much I've helped and how, what a great veterinarian I am and so on. Interestingly, we were talking about her problems, her health problems she was mentioning to me, and I asked her some questions about it. And it looked to me like she had not really received a proper diagnosis. She'd had serious problems and was continuing to have health problems, but I didn't think the diagnosis was very accurate. And I said that to her. I mentioned to her some things specifically that could be done to determine it more clearly. And it was, just to summarize, to say it was obvious to me that my opinion was dismissed, that in this regard, I didn't really know that much compared to her doctors. Now, I give you these stories not so much to say that how good I am or I know better. That's not the point. Rather, that it points to something that is relevant to our discussion here. And that is there is a different view of animals as compared to human beings. And the fundamental basic concept underlying this is that animals are not as valuable as human beings, or they are inferior to human beings. And this then propagates to the level where the veterinarian, though we deal with very similar problems, very similar physiology, as we know, is seen as not as knowledgeable as the human doctor. So it's a kind of it's a hidden assumption that's not brought out usually. And unfortunately, it's an assumption that we all hold in our minds. Why is this so? What's different about human beings? We have very much the same bodies, very much the same physiology. Very much of the genetic makeup is the same. I've read that compared to, say, chimpanzees, there's a difference of like 1 or 2% in the DNA, if that. And of course, dogs and cats are not quite as related, but still, I think the great bulk of DNA is the same. So we know there's really not a great bit of difference. We know animals have senses, and they sense things just like we do. It's obvious they do. They have emotions. They have memory. So the basic difference with human beings is that we have developed the ability to produce and form symbols in our mind. And by that I mean words, images, and concepts. we've developed this much further than animals have. And so if we use the word dog, for example, the word dog has great meaning to us, but it's not the same as the actual animal that it's referring to. If we're looking at that animal and we're calling it a dog, we're using a symbol in our mind for that animal. And that symbol is loaded with thoughts and emotions and concepts. So human beings have, over time, come more and more to operate on the level of symbols in the world. So much so that we've even formed a symbol for ourselves. Each of us think that we have a self-identity, which is an idea in the mind, a symbol in the mind. Well, the outcome of this is that we value this ability so highly that we think that animals not having it are inferior to us. It's very much like it's like asking the fox what the fox thinks about the hens in the local neighborhood. And the fox says, well, they taste very good. I like them, but they're not as smart as we are. So it's actually a prejudice. It'd be an interesting topic, not one we're going to go into, but the question is really, what is the value of human thinking? Look at the world we've created, both positive and negative, but that's a different topic. The thing is that there is this underlying prejudice in our minds for almost all of us. I have met very few people that don't have this, that human beings are superior to animals. And this has resulted in our society to using animals in actually terrible ways now, with factory farming, which is the way most animals are raised, terrible, terrible conditions, great suffering, medical experimentation, great suffering for animals. So this is very important because this is very much a source of suffering for human beings, but that, again, is another topic. So this prejudice exists in us too, so that we see the animal patient as different than the human patient, when in actuality they're very much the same. It doesn't really matter if if you're skilled in homeopathy, whether it's a human or an animal patient. If you were a human practitioner and you were faced with a human patient that had problems, observable problems, but could not describe sensations, you would basically have an animal patient. So in the study of remedies for use in animals, what we need to do is first assimilate and understand fully the remedy as it's known for human prescribing. And that includes the sensations. One of the things that's been learned in homeopathy is a sensation often precedes pathology. So if we read in the Materia Medica that there's a sensation in a particular part of the body, it's very possible that in an animal patient we will see pathology there. And if we have that knowledge, we can relate to that remedy. So I would say, in summation, that to be very skillful as a prescriber for animals, we must first master prescribing for human beings. With that knowledge, we then can apply that knowledge to a limited case, such as we see with animals. Much like it would be for the human practitioner that's, say, presented with a child that can't speak to them, or an unconscious patient, or a nonverbal patient. We read the cases of Kent and Lippi and others that prescribed for situations like this. And it was a great knowledge of Materia Medica that allowed them to prescribe for cases in which sensations were absent. So maybe another way to understand it is we think about the question of proving. Sometimes people will raise the question, well, we should do animal provings. And then on reflection, we realize that provings in human beings gives us much more knowledge, much more than we would get from observing an animal. And that with that full knowledge, we can extend the proving to the animal case. Very similar thing with clinical application. Knowing how to prescribe for a human being, we now can prescribe skillfully for an animal.